Checklist on Weebag attachment. First, you have to gather all equipment like urine bag, sample container, soap and water, and gloves. Check the doctor's order. The order sheet is the most reliable source and legal record of the patient. Explain the procedure to the mother or significant others. Helps minimize anxiety. Identify the client. Identifying patients accurately and matching the patient's identity with the correct treatment or service is a critical factor of patient safety. To prevent instances of misidentification and near misses, the Joint Commission requires that two identifiers such as a patient's full name, date of birth, and/or medical identification or ID number be used for every patient encounter. Perform hand hygiene, and you have to apply clean gloves. It reduces transmission of microorganisms. Provide privacy. It avoids unnecessary exposure of body parts of the baby. Wash perineal area with soap and water as needed. Washing ensures area is not contaminated before putting the Weebag. Then dry perineal area to ensure that urine collector will stay in place. Remove and discard gloves and perform hand hygiene. This reduces transmission of microorganisms. Remove the wrapper of the Weebag and make sure not to touch the inside part of the Weebag because that is sterile. Then, know the midline. Then, peel off the protective paper of the Weebag. Press adhesive material firmly against infant skin, ensuring penile shaft placement for male patient. In placing the Weebag to a baby girl, make sure that the whole of the Weebag is exactly placed in the meatus of the baby so that the urine will not leak. Make sure when putting on the diaper, it is not too tight. This is to avoid the urine from leaking. Check the bag at least every 15 minutes until an adequate amount of urine is collected. This is to check if adequate urine is already collected and to avoid leakage. Do not leave the bag on for more than 1 hour. Take the bag off if the skin develops irritation and/or symptoms of allergy. When adequate amount of urine appears in the bag, remove the bag gently. Then transfer the specimen to an appropriate container. Or you can fold the two adhesive surfaces together and seal the bag and put it in a container. This is to avoid contamination of the urine specimen. Fill out requisition form and send to the laboratory with the specimen as soon as possible. For best results, bring the sample within 30 minutes of collecting it. Then, perform hand hygiene to reduce transmission of microorganisms. Then last is documentation.